Welcome back to another episode of Limitless Live. I'm excited to introduce our guest today. This is Dr. Drew Ratner with American Orthopedics. He is one of the few people in the country that is doing orthopedic care differently, independently from a big hospital system. So really excited to talk to him about that today. But first, Dr. Ratner, thank you for joining me today. I appreciate it.
Yeah, thanks for having us. It's cool.
So I want to start just by letting you introduce yourself to our audience. So can you tell us a little bit of just your background and ultimately what led to the founding of American Orthopedics?
Yeah, so it's kind of been a long time coming, but I guess I originally went to Northwestern University for college, which is I played college soccer there.
Okay.
I guess I'm from Texas originally, then ended up in Chicago for college, and that was pretty much completely driven by soccer. And then interestingly, like soccer was kind of my introduction into orthopedics. And so when I was in college trying to kind of figure out what I wanted to do in life, I came across our team physician who was treating a bunch of my friends, different injuries. And so that was kind of like my intro into orthopedics. And so, ultimately I decided like, I want to become an orthopedic surgeon. So let's go to med school, and do the thing. So went to Texas Tech Med School after college was done. So that's out in West Texas. And then I matched here in Greenville at Greenville Health System. Prisma Greenville Health System is what it was called back in the day. And so that's where I matched for orthopedic residency.
Okay.
And so I was here 5 years, 2013 to 2018.
Okay.
Then I did a sports medicine fellowship down at in Denver at the Stem and Hawkins Clinic in Denver.
Yeah.
And so that was a great year in Denver. Learned a lot about sports medicine there. We covered the Denver Broncos and the Colorado Rockies, in addition to high school sports. So that was kind of a year of very intense sports type training.
Yep.
And then I ended up taking my first job back in Dallas, Texas, where I'm from. So I worked for a hospital system there, HCA hospital system. So huge, massive hospital system.
Yep.
And so I was there for 2 years, and it was a good, I think it was a good first job. It was very, it allowed for a good like general orthopedics. I took call, did a bunch of fracture work, was doing sports medicine stuff and doing also joint replacement, but it was a good job. It allowed me to kind of, start to really figure out orthopedics, start to figure out exactly which direction I wanted to take my career.
Yep.
But then ultimately my wife was like really wanted to get back to South Carolina. And so
Okay.
she's, I met her while I was in residency here. And so she's from here and her whole family's from here.
Yep.
And so pretty quickly she realized that she really wanted to get closer to home, South Carolina. And I love it out here too. So once I got through all my board certifications and all that, started looking for jobs out in this direction. I ended up, since I did residency here, I still had a bunch of connections through Prisma. So I ended up getting a job here through Prisma at out in the western part, Easley, Pickens area. So I've been out there for the last 4 years. So we came back in 2021 to 2025. And so I was out in Easley. And again, it was a great job. I was kind of doing everything I wanted to do in terms of sports medicine, doing a lot of joint replacement. We kind of started the robotic knee replacements out in Easley. So I was like the first one doing robotics out there. We started doing anterior hip replacement out there. And so I was one of the only people in the Prisma system doing anterior hip replacement. And then the first person out in Easley doing that. And so I got to work with the residents. So I always had a second year resident with me. So that was cool. And so I was able to, help teach the residents for about 4 years, and that was all good. But, as I continued, on in my career, I didn't like being an employee anymore.
Yep.
And so I really wanted ownership in things. I wanted ownership for a lot of different reasons. Probably most importantly, just like, cause I wanted to be able to decide everything, act on it. So everything about running my practice, or, the types of things I wanted to do, or where I operated, or how I hired people, how I fired people. I just wanted complete control. And working for a hospital system, working for a big hospital system, you basically have no control.
Right.
And so, you'd have quarterly meetings where everybody kind of complains, but nothing ever can get done because there's just way too many moving parts. There's way too many things going on.
Right.
So I was, I really wanted to be able to direct the orthopedic care that I was giving, very personally. And I knew, I knew the only way to do that would probably be in a more of a private practice setting. So I was, I knew I wanted to kind of get out of the hospital system, but in this community, in this area, really in the entirety of the upstate, there's only one private practice in town, and that's Kona, which is up in Spartanburg.
Right.
And so I had I had some talks with them, and I'm really good friends with a lot of those surgeons, and they're all really good surgeons. I think that's a great group, but I don't think the timing was quite right in terms of they had just hired some people. They're building a new clinic. It wasn't quite ready yet. And so like I didn't think the timing and I kind of wanted to be more in Greenville and not in Spartanburg as much.
Right.
So for all those things, I was like, well, my only option then would be to start my own practice. And so you know, honestly, I never envisioned that I would like start a practice from scratch. But that as I looked into it, I'm like, that's what I got to do. And I thought it was a really cool opportunity because I was like, if I can bring private practice back to Greenville, I think that would be huge, or independent practice.
Yep.
I think that it's very kind of sad / unfortunate that if you look really nationwide, but it's happened probably worse in this part of the country, that medicine has really lost its independence and it's become so corporatized, so hospital based. And I think, one of the reason a lot of people become a doctor or like even a therapist, or really anything in healthcare is like that physician patient relationship and kind of the autonomy. Like I think in healthcare, like typically and classically, there's a ton of autonomy, and it's like you and the patient, and you get to make all the decisions. And as it's become more and more corporate and more hospital based, you're just like it's almost like you're just like cog in the machine, and there's no individuality. You can't really market yourself. You can't even do like you can't do anything unique. You're just kind of along for the ride. I mean, and I think, if you just want to like show up every day, not really think about much in terms of the practice and just kind of deliver healthcare and like operate and do, see patients in clinic, then I think, hospital-based medicine is great. And that's what draws a lot of people to it. But I don't know. I wanted to really be in charge of my clinic and like really go through the, operations and how can we maximize things? How can we make things most efficient? How can we deliver the best care, deliver the best patient experience? And really the only way to do that is to have a ton of control.
Yeah.
And so all those reasons is why I ultimately started American Orthopedics. So here we are.
Fantastic. So, so many follow-up questions on that. My first one would just be though, if you could just get more specific, I heard you say from you as a professional standpoint, how, like corporate healthcare is a strain on you, but we also recognize as independent practitioners that it's also a strain on patients in some ways too. So I just love to hear specifically from the patient side of things, what motivated you to make this transition, and what do you feel like is different in terms of that patient experience now versus what it could be or what it had to be under the more corporate system?
Yeah, no, that's a great question. So, so I can, the way I run my office is I can kind of see all the bottlenecks, or like why does it take so long to get into some of these orthopedic offices? Like I hear all the time patients be like, well, it was going to take me 6 weeks to get into that person's clinic,
Right.
or, and then why are people, it frustrates people so much, patients, when they go to a doctor's appointment, right? And their appointment's at 11 a.m. and they aren't seen until 12:30, why does that happen? And so they're, and that's not to say I'm like perfectly on time all the time, but I think a lot of it is due to like inefficiencies in the clinic and inefficiencies in the way you schedule appointments. And so by me being in charge of everything, like I got to choose like what electronic medical record I'm using. I then got to look at different add-ons. So like, we offer online scheduling. So it's almost like you're making a dinner reservation. You just
Right.
like click online, like it's like, like it's Resi or, and you can click an appointment and it's like, boom, like you don't have to talk to anybody. It's quick, it's easy. You can email, you can like on our website, you can quickly fill out a form, and it's, one of our, either me or somebody that works for me gets it, calls you back the same day. You can obviously call us like normal, but there's, I wanted to put in all these different avenues to like easily get an appointment,
Yep.
and it is and I can make those switches immediately.
Yep.
Like, and there's no like, oh, let's have a Zoom meeting about like what EMR we're going to choose, or like, there's different add-ons to these EMRs to help with scheduling.
Right.
So like, and I don't have to talk to anybody about it. It's
Right.
like, I'm like, hey, this sounds cool. This sounds great. Let's do it. It's going to be easy for a patient to
Yep.
make appointments. So I think that's one thing you'll notice with our office is it's like super easy to schedule. And that's because, we've gone out of our way to maximize the efficiency of that process.
Okay.
And so that would be one thing, from the kind of the structural side of the way we run our clinic.
Okay.
Another thing would be like something as simple as like I wanted to start doing outpatient total joints.
Yeah.
So, I think nationwide, more and more people are doing a higher percentage of their joint replacement, whether it be shoulder, hip, or knee, as an outpatient. You go in, leave the same day. And unfortunately, like at the hospital system, like working for the hospital, it's like nobody in a lot of these hospital systems, nobody's actually doing that because they're not set up for it. And I think, and to be frank, here there's not a lot of ambulatory surgery centers because everything has been so hospital based.
Right.
So now there are a couple, but a big thing I wanted to start immediately was I was like, I want to get outpatient joint replacement up and going. And so, there's a couple surgery centers that I've partnered with, and I was able to immediately, put protocols in place. They were already working with some other physicians with other, with Kona and, some of the other systems doing outpatient, but I was, so I was able to start that immediately in American Orthopedics, which was cool. Because at Prisma, it was like I would admit patients to the hospital and then discharge them the same day. So it was like same day discharge, but it was clunky. It was inefficient. Patients usually were in the hospital for 8 or 9 hours. Now it's, I'd say on average from the moment a patient comes into our surgery center to the point they leave with their hip or knee replacement, it's on average, it's like 4 to 4.5 hours.
Yeah.
So
That's awesome.
yeah.
So specific situations like that kind of point to something that I figured we'd get to today. So I'll go ahead and jump to it now, which is I feel like in order for any process or an experience to be good, it feels like it needs to be a win-win for everybody, right? Like there's all these different stakeholders, whether it's the practitioner, whether it's the business, whether it's the patient. It's very hard to find situations in like the mainstream system where there's the win-win-win, right? Where it feels like everybody's incentives are aligned and everybody's winning in the same direction. So you give the example of, hey, it was really hard for you to implement outpatient total joint surgery in the hospital-based system. Well, yeah, because what's the incentive for the hospital system to pursue that, right? Their incentives are not aligned with that, right? Like,
And in fact, they make more money.
Correct.
If you do it in the hospital, they make more money. Yeah.
Correct, right? So their incentive is actually to fight against you on that
Yeah,
a little bit. It's like,
100%.
why are we going to do the same thing and make less? Hold on
Yeah.
a second, right? Like there's a lot more codes to be billed by keeping this person here, by administering that medicine here versus sending it to the pharmacy first and letting them go pick it up however many hours later, whatever the infinite examples of that are. And so that is one of the reasons why we start our practice the same way, right? Where it's like, hold on a second. We know we could do this better, but unfortunately the system is literally incentivized against that because there's reasons that we do it this way. And it's not because it's for the betterment of the patient. It's because there's a little more juice that can be squeezed out of this orange. And so the system is designed to squeeze every ounce of juice out of that orange that it possibly can.
Yeah.
Yeah.
And that's, I mean, in healthcare in general, like I think the problem with our healthcare system is it's been kind of interesting because as I started this practice, I feel like healthcare is like returned to the forefront. Like it's in the, it's in the news a lot with like, why are insurance premiums so high? Why is our healthcare so inefficient? Why is it so expensive? And, we go through cycles, I think in life where, it comes and goes. And, in 2010 with Obamacare, it was like at the forefront, but I feel like it had been kind of put on the back burner. And for whatever reason, it's like, it's back like front and center, which was kind of interesting, like when I was starting my practice, but it goes hand in hand with what you're saying is I think, and we could talk for like, days or weeks about like the inefficiencies of our healthcare, but at its nuts and bolts, it's perverse incentives. And so all the wrong incentives are in place and you've got third party payer system with insurance and government, you've got hospitals with perverse incentives. And when you cut it back to just like a doctor dealing with a patient, and especially if you cut out insurance. So the way you guys do physical therapy with cash, like if you get to a cash system, then it's like, okay, well now it's a real marketplace. Now it's a true marketplace where you're trying to provide the best value possible for the patient, and the patient's trying to spend their dollar in the most effective way possible. And that's how you deliver the best anything in a market, but in this instance, healthcare. I mean, but that's how business should be run.
That's right.
And marketplace economics is the way that things like thrive, right?
That's right.
But when you're, when you have insurance companies and you have hospital systems, it's the whole marketplace is kind of bastardized.
Yeah, absolutely. So it goes to another kind of business principle that I've learned and been able to maybe better articulate over the years, is that at the end of the day, the payer is the customer. Okay. So that's why the payer system matters so much. So we can use infinite examples of, like, if we have car insurance and our car gets in a wreck, our car insurance may approve some amount of damage or repairs to our car. The auto body shop isn't going to go, well, you know what I'm going to do is I'm going to tune it up to 2x what the insurance company is going to pay out. It's like, no, whatever the payer is going to pay is what we're going to do, because they're actually who we work for. They're the one that's paying us. Right. So the same thing happens in healthcare, unfortunately, where when it's 100% reliant upon whether it's a federal payer, government-based payer, whether it's a private insurance plan, it doesn't matter. Unfortunately, practices are constrained to the point of, like, I mean, you can't not make money doing practice, right? So we can't just like frivolously pick here and there. But unfortunately, what that model becomes then is we're pigeonholed into this narrow pathway because this is what's ultimately going to get us paid.
Right.
And sometimes that may or may not be the best thing for the patient, but if we'd like to get paid and continue to have our doors open tomorrow, we kind of have to at least do this thing that's going to get us paid, and code it this way and structure it this way, regardless of whether that may be the most evidence-based, that may be the most individualized thing that this person needs. Right. And so I'm sure you've probably already experienced some of that. I know at this current stage, you still do work with some insurance practice, but even just having the autonomy to say, hold on a second, like, we can still think outside the box of, these are the only pathways that we're allowed to follow because this is the only way that we can make this happen financially. I even saw a LinkedIn post that you did maybe last week or so, actually being transparent about some of the operating room costs versus what's actually being reimbursed through some of these insurance plans. So I'd love to hear you like give a little bit more detail to that, in terms of, because I think people see a $20,000 or a $30,000 or a $50,000 surgical bill, and they assume that that's money in a surgeon's pocket. So talk a little bit about like the actual constraints now that you're actually behind the scenes and have even more visibility and in some ways control or choice in a lot of those areas. What have you learned, and how has that kind of changed things in terms of practice now that you know and can be more transparent to patients about, like, hey, here's what this gets billed, but here's what your insurance actually pays, and here's all the costs that have to be covered associated with that.
Yeah. So that's, and going back to your previous point of like, what can you do in private practice that I couldn't in the hospital? I think cash offering, like, so we offer cash pricing, right? Which is, it's so funny, like what a revolutionary idea that is. Cause I posted on LinkedIn basically like 6 things, like, hey, if you're a new patient, it's $200. If you're an established patient, $150. An X-ray, $75. If you need a cast for a wrist fracture, that's $100. If you want a steroid injection, that's $50. Like the most basic, like if you showed this to any like business person, they'd be like, okay, like that seems normal. And it was like, people think that is like the most revolutionary concept. Like, oh my God, like you actually, because if you go into most of these hospitals based systems, if you're like, hey, like I've got no insurance, like what am I going to pay? That nobody will be able to answer that for you.
Oh, it's unbelievable.
They're like, well, let us treat you, and then we'll throw the bill out there, and then it'll get processed in some way, and then there will be deductions because you're self-pay, blah blah blah, and then who knows what ends up actually coming. And it may be something reasonable or totally unreasonable, but you have no idea what you're getting into for weeks later. Right. And so, like, so I was, and there's so many patients out there now that, insurance has gotten too expensive, so they're going without insurance. Or, there's a lot of these self-funded plans or direct care plans where people are essentially getting catastrophic insurance for something really bad, but anything elective, anything through a specialist is cash. Right. And what these plans want to know is like, they want to know, like, when they show up, they're sending a patient to you, like, just what is it going to cost? Right. And I'm in a unique position to tell them exactly what it's going to cost. And almost nobody else is, which is like, it's pretty funny that it's given me this huge leg up just by telling people, hey, this is what it's going to cost. Part of the reason, And I'm able to look at it like, and so anybody, like you run your business and I run my business, I could tell you exactly every day, like how much money I'm spending. Cause
Sure.
I mean, I look at every expense I have and there's tons of expenses.
Yeah.
But I know exactly what my costs are, right? Which then allows me to better make a better informed decision on like, hey, for my cash patients, this is what it's going to cost to come
Yep.
and see me. And most people are shocked at how it's not that expensive.
Right.
And so, and it really isn't when you remove the bureaucracy and just the games of insurance and you're just paid money right away. Like every other business, you get your money in your bank immediately. It's like the power of that is like amazing
Mhm.
to not have to pay anybody. I mean, I pay so much money every month just capturing insurance charges, just
Right.
getting an insurance company to put that money in your bank account.
Right.
Not only am I paying people to do that, but then it also, on average, I mean, depends who the payer is, but sometimes it can be 6, 8, 12 weeks
Yep.
to get that. So the power of just having that money in your bank account. So I think that was a long roundabout way of answering I mean, so, and what people don't realize when you're going through the insurance market is, you get these bills. You get these, all the money. The problem is the numbers are also fake because
Yep.
there's charges, right? So everything has a charge associated, which honestly is just randomly generated from the electronic medical record. But there's like charges, but nobody actually pays that charge.
Right.
Every insurance then has negotiated with the hospital, the surgeon, and anesthesia, if this is a surgery, which rates they're going to pay. So a lot of times the patients see the charge and it's this astronomical number. Well, their insurance company's not even paying that,
No.
depending on who their insurance is. Every insurance company pays me something different. For the exact same surgery, I get paid a totally different number based on your insurance.
Mhm.
And that's the way everybody with a tax ID. So, surgeons at Prisma, they're going to have a rate, right? Surgeons at Kona or Spartanburg, they're all going to have different rates based on their tax ID. And so, but patients, all patients see is that charge.
Mhm.
And then ultimately some huge big bill is paid, but the amount the surgeon is getting is going to be incredibly, incredibly low.
Yep.
So, if you look at hip replacement in general, if you do hip replacement at an outpatient surgery center, I think if you look at Blue Cross Blue Shield rates, it's going to be something like $24,000 or $25,000 that goes to the surgery center. Anesthesia is going to make like $1,500 or $1,600, and the surgeon's probably going to make like $2,200, $2,400, something like that. So I mean, the surgeon is usually going to be bringing in maybe like 10% of the total bill. I mean,
Right.
it's going to be different in every situation, but
Right.
and then what a lot of people don't realize either is that money is then that's total revenue, right? So that
Correct.
you got to pay all your costs.
Right.
So your costs come out of that. And so, yeah, it's not as much as people think. And so
Oh,
that's
right.
that's what I posted on LinkedIn.
Yeah.
It was a random day, that it was 6 surgeries that I did, but they were big surgeries. They were like shoulder replacement, hip replacement.
Right.
But yeah, I think people, and the point of that post, it was to kind of be like, hey, like, this is what a surgeon's like bringing in, and that includes, 90 days global. So you're seeing these patients for 90 days,
Right.
3 months.
Right. You might have
And
to follow up with them 5 or 6 more times.
and then the phone calls, like the
Right.
amount of times, like some of these people call.
Yep.
I just had a post-op day 1. I just did a guy's shoulder replacement yesterday, and he showed up already today. He was just like worried about, I mean, everything was like totally fine, but it's like, there's no additional, revenue for that. That's all included for 90 days. And then all those phone calls, like, hey, like what, calling your staff, like, can I get a handicap placard? Right. These
Right.
are all just like bundled into the 90 days. And so people, the point of that post was, number one, I think most people would be pretty shocked at how little that number is.
Yep.
That the surgeons are getting. But then number 2 is the main point of that is like, as an independent, I could sit there and complain about like, oh, we should get paid more, but it's not going to change. Like the government's going to have to change and you'd have to fight these
Right.
huge insurance companies. And yeah, it'd be great if those rates went up, but more realistically, I think what it shows me is like, I have to come up with alternatives
Mhm.
to make it work because, I think it's almost like you can pay for your overhead with the surgeries, but if I don't come up with other alternatives,
Yep.
whether it be cash-based things or, like we were talking about stem wave or,
Mhm. Mhm.
different, whether it be biologics, PRP or BMAC injections or some of these things that you can do as a cash service to, outside of insurance, I think I think, especially as a small independent practice, I think that's the only way to make it work.
Yeah, for sure. And so the point you made about revenue is so important because when people see surgeon, they think that one individual person. But for you, you have an entire team around you that
Right.
that's the pie that you have to feed them out of also, right?
Yeah.
Like that's the way your business makes money. So even if somebody might think, well, wow, $2,000 to do one procedure, doc, that's still a lot of money. It's
Yeah.
like, but hold on a second. I got 4 or 5 other people at my office, my person that schedules, my person that, does my x-ray technology or whatever it is, right? Like that's the revenue that our practice brings
Yeah.
in to pay all of them. So that's not $2,000 in your pocket, right?
Yeah.
That's $2,000 in the payroll bank account that eventually has to get paid out to however many other people too, right? And that is the challenge, right? Is that it might seem like a bigger number than some people might be accustomed to making in a day or in an hour, but then when you see how many different ways that pie has to get split, it should change the perspective a little bit. Yeah.
Yeah. It's my brothers. No, I've got 3 brothers, and I'm the only one that went into healthcare, and so and especially starting this practice, a couple of them are definitely business minded too. So
Okay.
ask me about things, but like and so they'll be like, I always tell them like, what do you think Medicare, like what does Medicare pay a surgeon to do a hip replacement, right? And like, do you have any idea? You saw my posts, you might, but
I'm gonna try to remember, but
so remember, this
I'm gonna
includes
guess,
90 days of global,
right? I mean, I'm gonna guess it's like $2,500.
So 1170,
Woo,
1,170.
Yeah.
So I told my brother that, right? So most of and people out of healthcare, if I ask just a random person, usually I'm like, hey, what do you think a surgeon gets paid to do hip? Honestly, almost everybody says like $10,000.
Right.
I'm like, if I made $10,000 on a hip, then it would be like, that'd be amazing. But yeah, so it's 1170 is what Medicare pays right now. And so but then my brother, I just had this conversation with him a few weeks ago, and he's like, well, how long does it take you to do a hip replacement? And I'm like, probably 45 minutes. And he's like, well, that's a pretty good hourly rate. Like you're making there. And it's like, okay, but it's not, first of all, it's like, there's a lot more time involved because there's like setup of the room so you're not sitting there operating every minute of every day, first of all. And then it's all the follow-up care and everything that goes into it. And then paying for your staff, paying their benefits,
Paying your liability insurance,
paying liability, paying malpractice, liability, paying for rent,
right?
And purchasing, paying off loans. Renovated the clinic, you brought a new X-ray machine,
right?
So yeah, I mean, it's like any business, you have all these costs, and so it's like, but yeah, it's a lot of people have that reaction. Well, that's a pretty good dollar amount in an hour, and but it's you got to look into all the time that actually goes into it, and then all the costs.
So you're an orthopedic surgeon. There are orthopedic surgeons across the board. There are some that are hyper focused on one body region or one type of procedure or one type of care that they like to deliver. And then there's some that are kind of the jack of all trades they'll do anything from joint replacements to trauma surgeries to anything else. So obviously when you're a one-man practice, you probably have to be a lot more of a jack of all trades, but talk to me about your perspective on that. Like, because there are some people that would sit there and say like, hey, you don't want to go to that generalist guy. Like you want to go to the guy that does 1,000 of these a year, whatever. Like, so how do you respond to that whenever somebody says, hey, you sure you want to get that guy to replace your knee when you got this other guy over here who's doing it 500 times. And in one day he might do a knee, a shoulder, a hip, and an ankle,
Yeah. Well, no, I mean, it's a good question. It's something that's a great question. And I talk with a lot of my friends about that all the time. Because I have friends, everything. I have friends that are more generalists like me. I have friends that only do hip and knee replacement. I have friends that only do sports medicine. Friends that only do trauma. Right. And I think, you don't have to do 1,000 of something a year to be good at it. Now I do think in general, the more you do something, the better you are.
Right.
And there's certain procedures that are really common and there's certain that aren't. So I do think, and when people ask me, like, if you're getting your joint replaced, if you're getting a hip, knee, certainly hip or knee, and really even shoulder replacement is not quite as common. So I don't think those numbers are quite as high, but like if you're getting something like a hip or knee, like I'm like, your surgeon should be doing at least 100 a year.
Okay.
Now all things being equal, like is 500 better than 100? At some point I think the returns are limited. I don't know when that is, but you should be, I think if you're doing at least 100 a year, then I think that's good. You're doing 2 a week. It's like everybody's like, your staff is knows what's going on in the OR. People know what you're doing. I think 200 would be even better. That'd be like 4 a week. And so I think in general, numbers are great. And I think whenever you're going to a surgeon, you should 100% should ask them, how many of these do you do per year?
Okay.
Especially with things like that. Now, if you're talking about this super like weird one-off, right? Nobody's
Right.
going to have done 100, but like
Yeah.
things like rotator cuff repairs, knee replacement, hip replacement, shoulder replacement, like you should ask your surgeon, how many of these do you do a year? And if they said like, if it's a knee replacement and they're like, well, I do about 20 a year, like that would worry me.
Sure.
Now I think you need to do at least 100, 200 would be great. And the specialization thing's hard because like you can't really, part of me is like, well, yeah, if I could have I would love to just do 500 hip replacements, 500 knee replacements, and 500 shoulder replacements a year. But you have to adapt with
Right.
your practice, so you can't, it's not really a choice you could make. And so like you could be like, all I want to do is knee replacement. And eventually you probably would get really busy, but you'd
Right.
also be sitting there for a while doing nothing.
Correct.
And so I think, and I do have a broad scope of practice, and that kind of just developed, I with being in Easley and then my first job in Texas, I saw a lot of ER consults, and and it's just like what I got busy doing. And
Mhm.
there's nothing like, if I don't feel comfortable with something, or if it's kind of a weird, I don't do a lot of foot and ankle stuff. Like
Right.
if it's a broken ankle, I'll do it. But if it's, a weird, like cavus foot, or some type of osteotomy in the foot, it's like I'm not going to do any of that. Or any with hands, I'll do wrist fractures because I see a lot of those. But even like carpal tunnels, like I send out, like
Yep.
trigger fingers, like obviously anything like super complicated in the hand, like a CMC arthroplasty, send those out.
Right.
And I think you certainly need to know like, hey, what do you need to send out? Like what,
Right.
what would be better off with somebody? But I don't know, like a lot of things, just as I've been in practice more and more. I mean, I was one of the busier guys at Prisma. So
Yep.
I do a lot. It's most of the things I do, even though I do a lot of them, it's like, even though I do a lot of different things, I do a lot of quantity of them.
Okay.
And so, I don't know. I think ultimately as a surgeon, you want to make sure that you're doing like a really good job, and you need to
Okay.
feel really confident in it. But yeah, the numbers game is like, I don't know the exact right numbers. And for certain, when you come out of practice, you can't like you're never going to come out and start doing 1,000 joint. You've got to like build up. So it's,
Mhm.
yeah. So I think but that's the constant question, like that, a lot of residents would ask me, because I had a
Right.
more general practice than a lot of people, like, hey, like, how do you manage, and I think you just need to make sure, the broader your practice is, you just need to make sure that you got to read a bunch. I mean, I'm constantly talking with different friends who do sports medicine stuff or joint stuff. Like
Right.
I'm on a bunch of different text threads. Like I've got my
Right.
joints thread where my friends who do the most joints, and I'll text them x-rays. Like, hey,
Yeah.
what do you think of this? Like, what do you think of that? Sports stuff too, trauma stuff. And so I think if you're going to do stuff, you just need to stay involved in terms of with colleagues or other people, stay on top of your reading, make sure you're doing as many as you can.
Yep.
And, that's what's most important at the end of the day. But yeah, no, it's a constant, and the more numbers you do, it's like golf. It's, it's like, yeah, the person that golfs every day is just going to be better.
Sure.
It's like,
Just
so
reps.
you just, it's reps. A lot of orthopedics is reps. So, I mean, I try to get in as many reps as possible. And,
Yeah.
cause the more you do, the better you are. And
That's awesome.
yeah. I mean, if you look at surgeons around town, typically like there's the surgeons everybody knows. Most of the time they're doing the most of it. So,
Right.
yeah.
That makes sense. So I guess I wanted to ask then about, for people that do have surgery, obviously you're a surgeon, so that's a big part of your practice. The recovery part doesn't stop at surgery. Obviously, there's a lot that goes into post-operative recovery and stuff like that. And I get to check my bias at the door a little bit, particularly when I'm, reading some research recently where we look at, I'm sure you're familiar with some of this. Like we look at total hips, for instance. If we look at rehab programs from basically unsupervised telehealth and like your traditional formal PT for really low risk patients, there's really no difference. Like those folks for the most part
For
do
hip
fine.
replacement,
For
yeah.
hip. Yeah, you know what I'm saying?
I
Like
I don't send my hips to
that's what I'm saying. Like
therapy, so.
if you, as long as they're low risk, right? And
Yeah.
if there's somebody that's high risk, like got a lot of comorbidities and metabolically compromised, maybe a different scenario. But we're
Yeah.
talking like the person that's like, they were 55 and pretty darn active, and they just
Yeah.
have primary OA of their hip, right? It's like this person's probably going to do fine, right? But there are some other diagnoses that are like, it's like TLC, slow and steady wins the race from a rehab standpoint. There's honestly a lot that they can do to screw it up along the way, right? So it takes some guidance. So I guess I just want to hear from your perspective, what does that collaboration or partnership look like with physical therapy or other members of the rehab team. And to you, just like we have to kind of have these conversations with patients all the time of like, what makes a good surgeon? Like what am I looking for in a good surgeon? So I'd love to hear your perspective of like what makes a good physical therapist or a good physical therapy experience? Because I'm sure you've probably experienced both sides of those coin at some point in your career.
Yeah. Yeah. So, it's tougher for me to speak to the specifics of physical therapy. Like, from my perspective, like the way I interact with therapists, like for me, what makes a good therapist is just somebody who's like communicating,
Exactly. That's a
And
big one.
so,
That's a huge one.
yeah, I mean, it's great to hear from, and usually therapists, like a lot of therapists have my cell phone, or they know how to easily get in touch, email
Yep.
or something. Just be like, hey, like, so, I've been seeing it. She's not progressing as quickly as I'd like, or like something changed, or you might
Right.
want to get her back in, like to get
Right.
an X-ray or something like that. So for me, that's what's super valuable.
Yep.
And I know, you know, the more one-on-one time that a therapist is able to spend with a patient is big, because
Huge.
that's what I hear. And I know that you guys, especially from these cash-based
Mhm.
ones, like that's what you guys can guarantee is one-on-one time, because the biggest complaint I get from some of the bigger corporations is like, oh, there was 4 patients for one therapist or 3 patients for one therapist. And
Right.
so I do know that like one-on-one time is huge for these
Yeah,
patients.
for sure.
And uh, in terms of the real specifics and techniques of therapy, I don't know. I'm like
Oh
a little
no,
out
and
of
that's
my
not what I was
element,
asking,
but
but
like,
no, just experientially, I'm sure you get feedback from patients
Yeah.
about like what was a good experience versus a not so good experience.
Yeah.
Yeah.
and it's good. Like, I mean, I think every surgeon should have good relationships with therapists in town, right?
Mhm.
Which is kind of why I like doing something like this, or like,
Absolutely.
I don't know, I have therapists reach out to me all the time to like shadow, and which I think is like great, because they get to see, hopefully they get to learn something just from seeing like me in the clinic. But then,
Yep.
more so, it's like we get to interact with like, what like, what would you do here? Like, because
Yeah.
sometimes, we get in our own worlds, and it's
That's
like,
right.
I know the surgeon world, but I don't know like what you guys are doing. So I think it's good to have a relationship with your therapist, just to, you can learn from them. They can give you good information about the patient.
That's right. Yeah. Well, you'll probably agree with all this, but I'll just throw a couple things out there from our perspective. Things that we kind of stand on are, you talked about the one-on-one time. That's really important. So that's something we guaranteed our folks are going to get at least an hour of one-on-one time when they're coming for a physical therapy appointment here. Something that kind of goes along with that, though, is continuity. Again, I don't know if that's
Yeah.
something that you've seen a lot in the past, but unfortunately, in the bigger healthcare systems, it can be I saw therapist A on Monday and therapist B on Friday and therapist C the next week, and then I'm back with therapist A, and it seems like they maybe all know what they're doing, but they all take a little bit different approach to it. And so now I don't really know. One of them told me I could take my sling off at home, but the other one told me not to. And it's this whole like, who's actually in charge here situation, right? So that's something we really try to stand on. I think another one, though, is just the value piece. And what I mean by value is if I'm going to ask you to come here, it needs to be a valuable use of your time. Unfortunately, when we get people who have like feel like they've run the physical therapy ringer and they come in, the experience I get a lot is like, yeah, they just told me to come in and I just did the same 5 exercises. And then I came back 2 weeks later and I did the same 5 exercises again. It's like, if I'm going to ask you to be here, it needs to be a valuable use of your time and something that you couldn't possibly do on your own. That's the point of you coming here, right? So if we're going to create an experience that says, hey, I'm adding value at every step, then we actually need to be okay with saying, I don't need to see you until next week. You're doing great.
Right.
Like, here's these 2 or 3 things to work on. And when we come back next week, we're going to reassess or remeasure these other things. And if you're ready to progress to the next level, then we do that. If you're not ready, we don't do that, right? We say, hey, your body just needs a little bit more time. Or, hey, maybe we've missed something along the way. We need to re-examine this and treat this other thing. But God forbid somebody comes back 2 or 3 times in a row and says, yeah, they kind of just like ran me through the same regimen of 4 or 5 things over and over again. And it kind of felt like I paid a lot of money for somebody to watch me do the thing that I probably could have just found a YouTube video on and done myself, right? So from our perspective, that is one of our thoughts and goals all the time. Is just like every interaction that we have should be valuable. Otherwise, I value people's time, money, and energy, right? So if I'm not using their time, money, and energy well, then what am I doing, right? That's a real big part of why we do what we do. All right, so I wanted to ask, why American Orthopedics? What's behind the name? Was it just a Google and a SEO play, or is there like is there a patriotism behind this? Like, what's the reason behind the name?
Put this on Do Not Disturb, but it's still making
If it might be your watch too. I don't know if you have your watch connected, but sometimes those talk to
Yeah.
each other. But go ahead.
Well, no, so like, yeah, American Orthopedics. When I made the practice. Obviously, name was important, and so some people do their names, right? Like
Right.
Ratner Orthopedics. But I was like, eventually, I want to have multiple partners,
Right.
and I'm like, that'd be weird to have. Like, I wouldn't want to work at like some other guy's name,
Right.
practice. And I actually have a good mentor. For me, he's my age, but he mentored me through this process because he started his own practice
Okay.
in Athens, but he started his practice with his name, and then now he's a partner, so they changed the name to like something more.
Yeah.
But like, so I was like, it can't be my name. And then I was like, I'm like, what would be cool? I was thinking like Carolina, but it's like Carolina Orthopedics and Kona's
Yeah.
already there,
Yeah.
right? It's like everything is like upstate this, Palmetto that, like,
Right.
it's like, I mean, how many like upstate
Right.
everything, right? Like, and so I'm like, that's boring. And so I don't know, but and I don't know. Yeah, I'd say I'm very patriotic. Like, I think that I love this country, and I think, I mean, I think it's the best country in the world, and I think like the opportunities we get in this country are incredible, and I mean, I love everything about the country,
Yeah.
and I'm like, it should be something everybody can rally. It's
Mhm.
like it should be something really positive for everybody, and so I don't know. Like at one point, I was just like it just came across American Orthopedics, and then I was like, well, that'd be great. I'm like, it's like, who knows? Maybe we go regional at some point. I doubt it, but I'm like, that'd make it easy to
That'd
go
be cool. Yeah,
regional.
absolutely.
But I don't know. I just thought it was I thought it was like a very positive, a lot of positive connotations. Very proud to be a part of what I think is the best country like in the history of the world, and it's just, I was like, we'd make for cool logos, like
Yeah.
cool colors. Like, so I don't know. The more and more I thought about it, I'm like, that's like that honestly was one of the first and most easy things for the whole, like I got my LLC like right away. I was like, that American Orthopedics is perfect. And
Nice.
so I got that LLC, like, right off the bat. And I was actually I was kind of worried. Like, I'm like, is it going to be taken already?
Yeah.
And then I went to get the website, and AmericanOrthopedics.com is not taken, but they wanted like $100,000.
Of course. Yeah.
So I had to do the AmericanOrthopedics.com.
Yeah.
So that's so that part. And then for phone number, I like looked up 864 America, and which is seven letters. It is like some old lady had, like, I called her. I called it. I'm like, let's see if somebody has this number. And it was like, unfortunately somebody did. And like, so she answered and stuff. But I was just like, I was going to ask him if I could like have the, but I was like, it was too awkward. I just hung up. Yeah. So I was like, all right. I was like, we'll just get a standard. Because I was like, that'd be great to have like 864 America.
Yeah.
But yeah. Now we just got a standard number.
So when you're an entrepreneur and you start your own thing, obviously there's people that, want to throw peanuts from the cheap seats sometimes or vice versa. But I'm just curious, what's been the reaction from like the local healthcare community to something new like this, whether it's your fellow orthopedic colleagues or anything like that? Are they more like, oh, look at this guy, he just wants to go rock the boat? Or is it like, man, kudos to him, he's got the courage to do something I wish I would do? Like, what's that been like?
Yeah. So I think from the community's perspective, it's been incredibly positive. Like everyone's like, oh, this is like so cool. Like it's so cool to not have to go to the, be in a hospital system, or, hey, it's so easy to make appointments with you. Or like, this is like, I mean, if you come into it's like coming into this place, like, right, this is like unique. It's not like a sterile environment. Like same thing. That's the first thing people say, like when they walk into our office, they're like, this is like so much different than a normal doctor's office. Like it's like open and welcome. And I mean, our staff is like so good. You can tell it's a very different experience.
Yep.
So from the local community, been like super positive. Like therapists have like, they're like, oh, this is great. Like you're not like a corporation. Like we can actually like, it's like it's like Prisma always sends to ATI, it's like, you're like, so it's like you can actually form like business relationships.
That's right.
Or,
they form walls to try to keep us out for sure.
Yeah.
I mean, it used to be a lot of these practices, you should be able to walk in and just be able to say hello to the surgeon or whatever that you've had a relationship with for a dozen years. And now they're like, who are you and why are you here?
Yeah.
Yeah.
But yeah, totally. And so from that perspective, it's been like unanimous. Like people are like, this is so cool. Like this is awesome. It's great. From like other surgeons. So other surgeons think it's awesome. Like they're like, I would love to be free of the hospitals. I'd love to have that. But most of them think I'm crazy because they know the inherent difficulties of private practice in general. But starting your own practice, I mean, that's like, I literally only know one other person in the country that started their own orthopedic practice. The guy that I mentioned in Athens. I had one other friend who started an ophthalmology practice.
Yeah.
And then I have several friends out there in independent practice. Like one of my very best friends is in Midland, Texas, and he didn't start the practice, but he
Right.
was, it's a very small group. And so, he deals with a lot of the same things I deal with, but like to literally start it, like to get your LLC, like get your insurance contracts,
Mhm.
get your EMR, get everything up and rolling. Like, honestly, I didn't even know if I'd be able to do it, but I just started going through the process while I was still working for Prisma. So I was
Mhm.
like, I have this safety net of this hospital job. I'm like, if it
But
just becomes too much, I can just give it up. But I was,
right.
for about a year, the last year I was at Prisma, it's like every day I would be, working on, okay, let me start, I made my LLC, got a tax ID. It's like, let's see what it's like. Let me get a Medicare. Let me get on Medicare's.
Yeah.
And then it was like, once I got Medicare, and then I found a consultant that could help me get on other insurances. And then once we got the ball rolling and I found places I could operate, I'm like, I think I can make it work. But
Nice.
yeah, most surgeons just think I'm crazy, honestly. And it's just because it's such an overwhelming task. Like just being an orthopedic surgeon's like
Yeah.
hard. Like there's a lot to think about, trying to master the surgeries, take
Right.
care of the patients the best you can. And it's like, honestly, that can be pretty exhausting in and of itself. But then you throw on like creating a business, running a
Mhm.
business, like everything that goes into that. It's a lot, but it's really fun. It's like, honestly, every day, like I love going to work every day.
Yep.
It's like, because it's mine. Like and I feel like everything I do is building it, and it's making it better. Whereas like when you're for a corporation, every little task you get annoyed at because
Yep.
you're like, this is just, for them to check a box or like to help. And everything that you do that's really good is like building the reputation of the hospital and not
right.
necessarily you
Yep.
or your company. And so I think that's what's really cool about owning your own thing is it's like every little thing, like, every little, every great patient experience. It's like, all right, this is like building our brand, it's
Yep.
not just building like the hospital's brand.
That's right.
So,
That's right.
but yeah, so it's been really fun.
That's awesome. So I bet some of the surgeons' reaction or other orthopedists' reaction have been too like, hey, I didn't pay this much for med school and I didn't go through this many years of training to then have to stress about payroll and marketing budgets and HR
Yeah.
and all this other stuff. Like I kind of did this because I like put in the time and now I know at least, like you said, I have this safety net that I can just like live comfortably, still practice at the top of my license and be an excellent surgeon, but not have to worry about
Yeah.
all those other factors. Right.
Yeah.
And so I'm sure for them, for some of you, it's like, why would you add that to your plate?
Right.
Yeah.
You're right. And financially it's tough. Like I kind of like prepared for this, but you go from making a really nice guaranteed salary that
Mhm.
just shows up in your, in your bank every 2 weeks, a
Right.
nice little deposit to like nothing.
Sure.
And I mean, for the first time since I've become an orthopedic surgeon, like I've actually had to like watch my bank account.
Yeah.
And it's like,
I get it.
like normally it was just on autopilot.
Yeah.
And so, and I don't know, like, I've been doing this and, I mean, everything's been going very well. I don't know if I'd say we're successful yet, but I mean, we're like, I'm covering all my expenses. I'm not
Right.
losing any money. Now, I'm not even anywhere close to making the money that I was like as a salaried
Sure.
physician yet, but I was really happy because we're not like, as of in December, so I opened October 14th. In December, I broke dead even on
Nice.
expenses and revenue. So I haven't put any of my own money into the business since November. So
That's awesome.
that part's great.
Yep.
But it's still like I'm not bringing home basically anything yet. And so that's what I've told, a lot of people just from peripherally, you're like, oh, this looks great. Like, I've had friends be like, I kind of want to start my own practice. And I'm like, that's awesome. I'm all about it. But I'm like, the one thing you have to realize is like, you have to be prepared to go a year, like making zero money,
For sure.
like,
For sure.
because I don't know. Honestly, I think I'm actually going to make money the first year, but but it's not, much, but like I've told friends, like you have to be prepared a year, like no, which is, it's like a tough pill to swallow when you're like, we all got expenses and,
Right.
and all the stuff. So,
Well, and when you're living at a certain income level, you have a certain lifestyle that brings with some expenses that then if you live that same lifestyle for another year, having no income, it can make for a stressful year. I'm sure. Yeah.
yeah, it's
It's gonna be willing to make some sacrifices too.
exactly. So
Yeah.
it's and I don't know, and that's, that's what I've told several friends. I'm like, hey, it's one thing to like everything that goes into starting a practice. Like, I honestly don't think there's many people that can do it's just like, there's so with like insurance,
Yep.
everything, like Starting a business is tough, but starting a practice, you have all the same stuff as starting a business. It's all the exact plus
Plus.
all the insurance
That's right.
and government
Yep.
regulations
Compliance,
and
all that stuff.
malpractice and
Yep.
compliance. It's like
Yep.
it's like a double whammy. And then all of your payments are like delayed too, like your accounts receivable. So
That's right.
so it's like it's all the challenges that any business owner has, but then it's like plus because of all this other
Yep.
stuff. So
Yep. So that leads me right to my next question is, you're obviously early into the process, but if there's anything you could do differently now, knowing it's been a couple of months at least, like if your future self or your current self now could talk to your past self 6 months ago or a year ago as you were laying the groundwork for all this, failing up, so to speak, what have you learned that you would have done differently?
yeah. Good question. Honestly, I'm not sure I know the answer to that just yet. But
Okay.
I think so I think a big part of starting the practice, I think we did a great job. Like I think the location we picked was great. I think we used Dovetail for renovations. I think that was great. I think everybody I've hired has been awesome. Like I haven't made one bad hire. Like that's been awesome. My wife, works as a nurse practitioner for us, but I mean, really, she's kind of been helping run the clinic, and like we were like, all my friends were like, how's that going to be working with your wife? Well, it's been great. Like, and she was stay at home, and now she's
Okay.
that's gone really well, and I think she's enjoyed it a ton. And like, I mean, smaller decisions like, all right, we had to like buy an X-ray machine, and all, that seems to be great. But I think, the probably the biggest thing when you're starting to practice, especially if you're taking insurance. So I tell people, like, if you're starting to practice, like, number one, are you going to take insurance or not? Because that's a huge branch point, right? So
Correct.
you don't take insurance. So like, you don't have to like, so in medicine, like if you're saying, hey, I'm not going to take insurance, well, that puts you down a whole other different pathway in terms of like, what EMR are you going to use?
Right.
How are you going to go about that? So I just, I would love at some point to not take insurance. That's like the dream. Like if you build a good enough reputation and stuff, but I knew to start with that I've got to build a reputation. I've got to build, most people when they're getting surgeries are still wanting to use their insurance. So I obviously was taking insurance. So when that puts you down a path of like figuring out your revenue cycle management. So in revenue cycle management basically means how are the insurances putting money into your bank account?
Right.
Like that process. And it's incredibly complex, and there's a lot of different ways you can go about that. And so and tied in with that is like what EMR you choose, like your billers and coders, how are you organizing that? There's all kinds of different companies that you can pick to help with that process. And so kind of the one thing that's to be decided was I use this big company that helps independent practices with that whole revenue cycle management.
Okay.
And so we'll see. I think, and that's kind of the big unknown, right? So you have to sign on for 3 years. And now these people take they take 7.5% of collections the first year, 8.5% the second year, 9.5% the third year, and you're tied in, right? So 9.5% of all your revenue goes out. And so that's all. I mean, it's pretty much going to be my number one expense. My number one, well, other than in my employees, it'll be my number one expense item. And so, we really won't know if but I think that's the one thing that I like think about, like, hopefully I made the right decision there, or like, would have been better off to hire that out at a lower percentage. But I mean, I guess I don't really know maybe that was a great play by me. I don't, I don't know yet, but that's definitely like the huge item that's out there, especially with that percentage continuing to go up. That kind of like, it doesn't worry me, but it's just kind of like, I think about it. Like did I make, did I make the bet? But that's a huge decision. I mean, and really, if you're taking insurance, that's going to be your number one decision, I think, as a business, is like, how are you handling revenue cycle management?
Okay. So let's ask the other side of the coin then. What's been the most pleasant surprise, or like the thing that's like maybe been most surprising in a positive way for you?
So I think so one of the things I was the most worried about, and that I thought would maybe limit my ability to even do this, was like, where am I going to operate? Because the hospital systems own most of the ORs with a few exceptions.
Sure.
With like literally one exception, I think, and that's one of the places at Spartanburg Surgery Center is 72% physician owned. But everywhere else, so the hospital system's all in it. I'm like, well, what if, since I'm not a hospital employee, like what if they, don't let me operate there, right? Then I have nowhere to operate, and you're kind of worthless as an orthopedic surgeon if you
Yeah.
can't operate. So I had reached out to Spartanburg. Well, originally I reached out to Pelham Ambulatory Surgery Center, which is 51% owned by Spartanburg Regional. Um, but they told me, like, I told them, hey, I'm thinking about going independent. Would I be able to operate there? And they were like, definitely, that'd be great. And I reached out to Spartanburg's, I think COO, somebody very high up in their C-suite, and said the same thing. I'm like, hey, like, I'm not, I'm just gonna be independent. And they were like, absolutely, you can operate at all of our facilities wherever you want. Like, that'd be great.
Nice.
So they were awesome. And then the last piece was I really wanted to do outpatient joint replacement, and I do anterior hips on a HANA table. It's a special table that not everybody has. And so Pelham Ambulatory Surgery Center didn't have that. And so the surgery center that does is the Spartanburg Surgery Center. And so that's all Kona doctors that own that. And so luckily, like, Kona has been incredibly nice to me. Like, they've been, I mean, in theory, I'm a competitor, I guess. I mean, it's like I'm one surgeon, they're like
Right.
20, so
Right.
they're way bigger, but they've been incredibly accommodating. Like, so they were like, no, like, we'd love for you to bring cases here. They've like offered me ownership. They've one day, like, I was having trouble with my x-ray, like, I didn't have x-ray coverage, and their clinic manager reached out to me one day and was like, hey, like, we could send somebody from our clinic to help cover.
Wow.
And so it's been amazing to me that Kona specifically has been so, like, welcoming to,
Okay.
like, really a potential competitor. It's so, but I think that's cool. And that's the way healthcare should be. Like, we're all, as doctors or as providers, as therapists, like, we're all in this together. Like, we need to support each other. But the problem is so many people feud. Like,
I know.
it's like, this hospital's doctors are going to be like, I mean, I've had people, like, that won't let me operate at their place, right? All because, like, I'm a competitor, not for any other reason than that.
Right.
And so, but that's like if you're a good physician, or if you're a good therapist, or if you're good at whatever you do, you're going to get busy.
Oh yeah.
And it's like sometimes people view this as like a fixed pie, and it's like any surgery you're doing is one that I'm not doing. And well, that's not true. Like, I think it's important for all providers, therapists, like, nurse practitioners, PAs, physicians, like it's really important to, like, be supportive of it, because really, like, you can grow together, like,
Right.
you can grow the whole thing. And so, and yeah, so Spartanburg's been great. Kona's been, like, awesome for me. And so that's been, like, really cool to see.
Yeah. So I love the abundance mentality you were just talking about there. Something that we reference on the PT side all the time is just utilization rates across the country. When you look at people that have, like, musculoskeletal conditions, particularly like musculoskeletal conditions that evidence shows we'd be very beneficial to them to help, it's like utilization rates are like 8 to 10%, which
Yeah.
means, like, when somebody with knee pain goes to some other physical therapist across town, like, I didn't somehow lose. Like, really, our burden is to say, how do we get more than 8 to 10% of people feel compelled to want to do something about that problem because they feel like there's an actual solution to it, and we might be that solution, rather than
Right.
the 8 to 10% of people who are already doing it. We're not having to fight over that 8 or 10%, right? Like,
Right.
our job is to actually, like, go to the market, go to the masses, and try to, like, increase the size of the overall pie, not our slice of the pie. You know what I'm saying?
100%. Yeah. And I think that, that's a huge, like, I don't think anybody, like, I feel like that's not stressed enough, like, in medicine in general.
Right.
Like, everybody views, like, the patients as like a fixed number, and
No.
it's just a fixed, but it's like, yeah, I mean, if you're providing a really good service, maybe that number grows, and it's, I don't know, whether, if you're a really good surgeon, like, you're going to you're going to be busier than you'd ever want to be.
Right.
Same thing with a therapist. If you provide an awesome service, you are going to be so busy. And it's like, you don't need to be out there, like, putting down other practices, or, like, like, trying to, like, there's no need to, like, feud between, like, providers,
Yeah, I don't know how anybody wins
Yeah.
operating
But
that way.
that happens a lot in healthcare. Like,
It
there's
does.
but yeah, I think the importance is just, like, focusing on yourself. And I think if you provide the best service and the best treatment, it's like, you're going to get busy.
That's right. All right, last question, and really just wanted to wrap it up so we can give a good picture of the value that you as a surgeon bring, but also just the practice that you've created. So I'll summarize by some things I've heard, but I'd love for you to just kind of fill in the gaps. So I think one is that we've talked a lot about the financial model, and the goal isn't necessarily to be the cheapest, but the goal is to be able to be transparent about what things cost, because it's really hard to make an informed decision when you don't know what something costs, right? In what other part of life or in what other industry does somebody sign up, walk in, walk out, and have no idea what bill they're going to get, what it's going to cost, and when they're going to get it, right? So
Um,
one of the main benefits is somebody can walk into your office, and whether it's just an exam, whether they get an image, whether they have some type of in-office procedure or other therapeutic thing that you can do there, they'll know exactly what that's going to cost that day,
yep,
right? Right. That's a
100%.
huge
Yep.
benefit, right? And then another thing that you mentioned is just access. That a lot of times if people are just going through their primary care physician and then getting referred to some big hospital-based orthopedic practice, they may wait weeks or months to get seen for something that may need more immediate attention, but also like their time and money are being wasted trying to somehow just like limp along until they get to that appointment.
Right.
Right. Yeah. And then third thing, obviously, just being that you get a comprehensive expert that's not just, oh, well, I got to go see this person for my knee, but I got to go see this other person for my shoulder, and then I got to go see this other person for my whatever else. You've got somebody in the orthopedic space that can really cover a lot of those bases for you. And like you said, you're comfortable referring the things that you aren't as much of an expert in or don't do as many of, but in a lot of cases, you are somebody that can be a comprehensive solution for folks.
Yeah.
Yeah.
Yep. And that's what I tell. I'm constantly going to like primary care doctors to be like, hey, if you need orthopedic stuff, send it to me. And what I tell them is like, send everything. Like if it's
Right.
like, because like, I don't want you being like, wait, well, does he see this? Cause I'm like, you know what, send it. I mean, I can like, for example, backs, right? Like I don't do back surgery. Now, a lot of back issues have hip issues, but I just send them. I can get x-rays. I can order an MRI. And then I know I've been around town forever. I did my training here. So I know all the best spine surgeons, right?
Right.
And I can text them and be like, hey, you need to get this guy in. He needs a, discectomy or
Yep.
whatever. Same thing with hand surgeons, foot and ankle surgeons, like all the best guys in town. Like I know them all. And like, and I can refer,
That's
and
right.
and it's much quicker than kind of, and you can get into some of these places much quicker. I saw like I had a friend bring in and they're like 1 year old. They were worried about their hip, and it's like obviously I don't treat like
Right.
hip dysplasia, but I'm like, well, let's get an X-ray first of all. Let's make sure it's not like dislocated or
Right.
something. And then I'm like, if there's something weird or I don't like something on X-ray, it's like I know all the peds guys in
Yep.
town. Like
Yep.
we'll get you in, but that way we were able to get her in like the day of, because
Yep.
her child like wasn't walking and she was worried, and like
Yep.
so. But yeah, I think it's I don't know, like it goes back to our like specialization versus general. I feel like specialization is great, but sometimes in orthopedics we just get so hyper specialized,
Yep.
and it's like, all right, if it's like not your right knee, like I don't want to see it, So
Yep.
it's like it's nice for people to have a place where they can go be evaluated and either be treated by me, or if if it's something that you need to refer, it's like
Yep.
I know all the people to send you
That's
to.
right. And it's so funny you take that perspective because we take the same perspective on the therapy side. There's surgeons that meet us and either they see that like, oh, we do like to specialize in more of like the athletic sporty population, or they hear about our financial model and they feel the need of like, all right, well, let me feel like I got to like pre-qualify everybody that I send you. And I'm like, no, please don't do that. Like, let us have the conversation with somebody. And if we're the right fit, fantastic. If we're not, I promise you, in most cases, we know who the other great therapists are in town that do
Right.
things a different way or that might manage some things that we don't manage well. And we can facilitate that process a lot easier than you can. Takes that burden off your plate. You know that once the referral comes to us, like we're either going to care for that person or we're going to get them to the right place.
Right.
Like at that point, it's off your plate. You got to handle it. And we'll communicate to you about what happened on the back end too. So
Right.
you're not wondering like, hey, I wonder if John Smith ever got scheduled with a physical therapist. Well, I never heard anything, right? It's like on our end, it's like you either know immediately they got scheduled with us or, hey, we referred to so-and-so because
Right.
we're not a good fit or they need something that we can't do. I think I wish more practices were that way.
Yeah.
Like you said.
Because that's all people want, is they just want to know that their patient or whoever they're sending is like taken care of, and
Right.
that they don't have to like
Right.
check on anything else. So
That's
yeah,
right.
No,
That's
that's
absolutely
great.
right. All right. Well, let's finish with just a little bit more info about how people can learn more information about your practice, whether it's website, social media. How is it that people can find out more about American Orthopedics?
Yeah. So the best way is probably our website. So if you Google American Orthopedics, or it's theamericanorthopedics.com.
Okay.
And so we have all kinds of information on that website, but you can schedule online, like right on the front page. You can schedule online. It's got our phone numbers. It's got a bunch of the surgeries we do. I put a bunch of videos on there. We actually have a bunch more videos that are being edited right now that
Cool.
are going to come up. So it's got all the rehab. It's got rehab protocols. It's got post-op instructions. So it's a really good website. That's theamericanorthopedics.com, and then we've got a Facebook, Instagram.
Mm-hmm.
I think it's just called American Orthopedics.
Cool.
But yeah, so you can you can find us any of those ways.
Okay, awesome. Well, Dr. Ratner, thank you so much for taking some time to join us. Hope this is the first of many conversations, but I appreciate you taking the time and look forward to talking again soon.
Awesome.
Thanks.
Thanks.